This portion of New Day Northwest is sponsored by Aesthetic Rejuvenation by Dr. Brecht.
Hi there, it is the season to grab a swimsuit and head into the sun for some fun. Dr. Christina Brecht from Aesthetic Rejuvenation joins us today with options some folks might choose to feel bikini ready in a short period of time. Hi there, how are you?
Hi, good, thank you.
I keep thinking it's liposuction, but it's liposculpture that we're talking about. What is it?
So liposculpture is the next evolution of liposuction. So we do want to often debulk and remove volumes of fat, but we also want to start sculpting, and we want to see the muscles. We want to see that healthy, vibrant, strong body with arms, you know, defining out the deltoid muscles, the stomach, defining out the rectus abdominis, the legs, getting those nice quads, you know, just defining things just a little bit more.
So let's talk about the three areas that people often want to have something done with. The tummy area.
Yes, that's like the #1 area. And it's a super resilient area for, I mean, I talk to so many people who exercise and are healthy, and they're like, as I get a little bit older, my metabolism slows down. It is a very resilient area for both women and men, and it's a very easy area to liposculpt. And so in this particular patient, you know, she's right on that cusp there of, well, you know, we could do a tummy tuck. She has stretch marks and is a little bit older. But liposuction and sculpting sometimes, and if you have great genetics, sometimes the skin recoils on itself. And this is a perfect example of someone who all she wanted was liposuction. We did it, and this is her about 4 months out. So you can see her skin after I removed the volume and sculpted down. You can see the definition of her outer parts of her rectus abdominis, and she just looks great, and she feels better, and it motivates people to exercise and maintain it.
Which we need to do in any case, right? But there are some pockets of fat that you have on your body that you can exercise till the cows come home, and they may just exist there.
Absolutely, absolutely.
Arms. Let's talk about arms.
Yes. So arms, a lot of times heavy arms are genetics. And so we can do some easy, you know, it takes an hour in the office to just, or in the procedure room to lipo a little bit of that volume, and it just lifts it a little bit. And so this is from one day to the next. Patients often, you know, they're concerned, they're like, oh, am I going to look horrible the next day? Am I going to be completely contorted? Not really. So, I mean, even though she's swollen, even the next day, I did her inner arms, I did her love handles, I added fat transfer to her bottom. You can already start seeing, even with the swelling, that things are smaller and the skin is already rebounding back. So,
and it continues to do that over time?
The main healing is over that first 6 weeks.
Right.
But skin will continue to recoil and tighten even a year out.
Interesting.
So, yeah, it
okay.
gets better.
So inner and outer thighs.
Another very popular area to do. And often that's genetics too. I'll see people, and they'll be very petite up on the top and have larger thighs, and that's genetics a lot of times. And you know, it's hard to find pants and to fit into things, or you know, it's such an easy in and out procedure to do, and of course it complements exercise and eating right and all of that. Right. But you can see her before, you know, things are just a little lumpy bumpy on the outside, a little lumpy bumpy on the inside. And I did this on purpose. This is the very next day, the after. So you can already say, even though it's still swollen, that's going to go down. It's going to get smaller and smaller.
So is this something you do with an incision? Is it done no surgery?
So teeny tiny little incisions that I don't even need stitches. The instruments that I have help me minimize the amount of cannula sites I need. And so it's just really small. I mean, the next day we go to Band-Aids. They heal without stitches, so people can, if they wanted to go work out the next day or weight lift, they can get back into their routine right away.
So how different is that from, you know, liposuction from 10 years ago?
The liposuction from 10 plus years ago you know, there's a lot newer technologies now. That was like a higher powered suction, and the only way you could get out the fat was just suck it out with high tension. So there was a lot of bruising, a lot of pain, sometimes bleeding, a lot of bleeding with the older techniques. The newer techniques, because we add the tumescence, allows us to do.
I don't know what that is.
Tumescence is the anesthesia, the evolved anesthesia. So it's a combination of lidocaine, bicarb, epinephrine. It's what allows people to have more comfort, allows me to sculpt and get more volume, better contouring, less bruising. They also have more comfort afterwards. So they come back the next day, they say, like, this is great, I'm kind of sore, but not bad. And I'm thinking to myself, well, the anesthesia is still keeping you comfortable.
Right.
But already the next day they're out walking a couple miles a day, and you know they're motivated because they like see the results already.
So you go home the same day?
You go home the same day after the procedure. I see them back the next day. They're walking in 12 hours later, the next morning.
And
we
so
change their dressings. They
How
go
do
to
you
Band-Aids.
make a decision for a patient? You mentioned that the first picture we saw was somebody who might have wanted a tummy tuck, where you're going to get rid of some skin as well. How do you kind of know which procedure?
Well, you know, again, not everybody who has a lot of lax skin is going to recoil as nicely as that person. And so smokers, people that are older, you have lots of stretch marks from having babies or having gained a lot of weight and then lost a lot of weight, and you have this lax skin. There's some amount of skin that's just not going to recoil anymore. Our bodies have an amazing way of healing, but they can only heal to a certain point.
And you can tell us that or kind of assess that when we come in.
And then I listen to what the patient says too. If they really want to have a tight abdomen, then we want to do a tummy tuck.
Got it.
If they want to just debulk down and, you know, feel better in their clothes, then, you know, we can possibly just do lipo or have the discussion about down the line, maybe one day doing a tummy tuck, at least knowing that it is an option.
Okay.
Yeah.
Now, I understand you're on Snapchat now.
Oh my gosh.
What did doctors Snapchat? What do you put on your Snapchat?
This is great. So, so right now, I'm in the infancy of it all, but I can put on little snippets of in the OR when I'm doing surgery, talking with people. You know, it's a little Snapchat that I'm coming on this show today, and it's just a really fun way to network with another audience, and it's really fun.
That's great.
So I'm Dr. Seattle. So, so if you want to, you know, join my Snapchat, I'll accept you.
I will connect with you. I'm very new too, so there's no telling what it is I'm Snapchatting, but I'll do my best. Thank you so much. To learn more about liposculpture, to make an appointment for a free consultation, please visit Dr. Brecht's website, listed here on the screen, and of course we'll have that for you on our website as well.